Welcome everyone to our Senior Dog Care Summit Expo. I hope that you've been enjoying the past couple days and have learned a lot of things. Whether it's your first time joining in or your second or your third time, there's always something else that maybe you missed on one of the prior senior summits that you catch up on this time. And they've loaded up some extra presentations, which has expanded our platform. And I know a lot of you are going to have some questions that you're bringing in tonight, so we'll be ready to work off with those. So just as a little bit of a review of who all we've had, we've visited with Dr. Susan Borer with Chi Dog. She's talking about food as medicine. Dr. Doug English, he's got the handle on turmeric, so that's always good to have in your health basket. Chris talked about antioxidants. Katie Woodley with the gut. Will Falconer, a classmate of mine, we discussed the strategies in fine-tuning vaccinations, how over-vaccinating can be harmful, especially in the senior dogs. Shared about titers and helping you to understand why those are critical, and also some info on cancer. Robert Silver sharing his knowledge on mushrooms and arthritis and how that can all support the body. And then we had one of our sponsors, Vism Light. Sharon was sharing how light therapy can help. Dr. Ed with his silent pain, and many of you, I'm sure, have joined in on some of his courses. He's out there helping all the time. Dr. Hayek about chiropractic, one of my favorite topics. And then Dr. Bill, he did his little program on the toenail trims, which that's always really good, because that's one of the things with the seniors where those nails get too long, and it's really injurious to more than what you just think about when you're looking at the toes themselves. It really affects the entire body. And then Wendy Coran talking about cold laser, and Don Gleason at home, things that you can do at home to help that senior dog navigating throughout the house, making that home life safer for them. So we're ready to launch into some questions and get the summit jumping. There's a lot that we can go through, and I'm sure many of you have questions about these topics and how that factors into your animal. If you're trying to decide what you want to put out there, you're doing your typing, I'll just start with some of the subjects. Chiropractic certainly is very key for the geriatrics. And anytime that dog gets to be, well, younger, as they're playing rough, it's good to have chiropractic done. They're always running and bouncing off of things. And then when they start hitting that senior age, to get adjusted a little more frequently. So when they're younger, maybe it's not as often unless they've had some serious injury. But certainly as they get older, you want to focus on getting them chiropractically adjusted more frequently. Certainly at least monthly for the very older, the geriatric venue. And hopefully there's one in your area. If you're looking for somebody, you can go to avcadoctors.com, and then it plugs up, it sets out the map, and you can plug in where your location is and find some of the certified doctors. So they've done the programs through the teaching institutions, and then also taking the certification exam for the entire chiropractic association. So that would be key there, is finding somebody who's very skilled and talented in what they're doing. And that may be a chiropractor that's really, really good, or it could be a veterinarian. So check out their references and visit with other people that have visited them with their dogs. And then the key for that is, as those dogs are getting older and the joints are becoming more stiff and the muscles are becoming weaker, then keeping that fluidity, the nervous system, being able to move through every single joint all the way down to the feet and then back up to the brain, improving proprioception so that the brain actually knows and can help direct the body into where it's going. So that all becomes very important. Otherwise, they stumble and fall, and so there's more injuries that can occur. Also, that as well is going to help keep things more flexible. As the body gets older and it isn't moving as much, it can become stiff. So being able to get them adjusted, and also learning on your own to do a little bit of massage therapy. So there'll be some upcoming programs that'll help you with that. So some of my key points there with the chiropractic. I adjust extremities. Some of the doctors maybe only do the neck and the spine, to the spinal area, but I'm very key in also checking every joint itself of the extremities, because those are very key, along with the toes. I call them toe jams. So we like to get everything adjusted. So you can ask the doctor that you're considering hiring to do your chiropractic if they also adjust extremities. So that would be the legs. All righty. Toenails. Okay, we have a question. So what preventative screenings or tests are most critical for aging dogs? So if we're looking at screenings or tests, if you're looking at blood tests, then certainly you're going to do the CBC and Kim panel, where you're looking for destruction of the organs, the liver, kidney, that. There's a test called SDMA that measures kidney function as well. Generally, there's going to be thyroid tests that are included in that. If you're living in an area, like say if your dog all of a sudden developed greater degrees of pain, then you may also want to have those tick titers done, the tick screening. So look for the diseases of the ticks, whether or not it's Ehrlichia is a common one. And there's several of them that are now often done in-house. So you can get those results in a short period of time. So those would be some of the key ones you'd look at for the aging dogs. And then, of course, my favorite's going to be doing the fur tissue mineral analysis, taking a fur sample and then sending it to the lab. And that gives us an indicator of, excuse me, all of the nutrients that are being carried to every cell of the body for all the metabolic processes. So clipping some fur and sending it then through the doctor, or you can go to checkpup.com, and that's another place to get the test run. But it does give us information about what's really available for that entire body to run off of. All right, the next question. What are some simple home modifications to help a senior dog with mobility issues? Number one is going to be having surfaces that allow the dog to have some support, some friction. So a lot of homes nowadays have tile floors, wood floors, parquet floors that have been look like wood or something, they're inlaid. All of those are very slick. And as the muscles get weaker, it's hard for that individual to actually get their legs up under them and to push off. So they tend to slide more. And the more they fall, then two things. One is they get hurt. And number two is that they get to the point where they go, well, what's the purpose? I'm just going to stay down, because if I get up, it's a struggle. They pull the front muscles and hurt something else. And then they just kind of sort of give up in that. So having rugs down or yoga mats, surfaces that they can walk on. It's going to change the scene of the home for a while, but it's really, 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 really important. So that's number one. Number two would be, if you have any stairs that they're having difficulty on, is making sure that those stairs are barricaded so that can't accidentally get to a place where then they fall down the stairs. So that would be putting up some other gates, like you would have baby gates or something like that. So watch out for the stairs, get some traction. Also making sure that the furniture allows them, it depends on the size of the dog, that how you have your furniture in the house, if it's a larger dog, that it gives them room. They got to make bigger circles. They can't turn around in as tight of a zone as they used to. So make sure they can make big loops so that they can get themselves turned around and they don't feel like they're backed up or they get too scrunched. Also, if they do like to get up on the furniture, that it's easy for them to get down, you may need some ramps or some steps. And those are ideally would be that you start training them how to do that when they're younger, rather than waiting until they're real old. Because the other thing that happens then as they get older, the vision goes. So they develop that nuclear sclerosis, which is what makes their eyes be a blue color. And that with that, they don't see as well in the dark. And their ability to fine tune is not there. Their depth perception is lost. So they will hedge on going downstairs outside because it's too dark. So if you start putting in lights, they'll also have some lights on that they can see. All right. Making sure that there's lights around the house so that they can see better. Because as they get older, they'll get themselves to where they might want to get up and go get a drink, but then they can't see and they'll just stand there in a stupor, or they'll get themselves into a corner and stand there. So making sure that there's extra lights on for them at nighttime, a dog level surface, not necessarily up high in the ceiling, but lights around the floor so that they can see. And there's a lot of different style of lights now that can help make that easier. So all of those things will help with, setting up the house so that it's a little bit more senior accommodating. The other thing that's really good too to help them with their toenails, aside from keeping them trimmed, are Dr. Busby's toe grips. And they're really, really, really good to get them on those toes. And sometimes you can start with just having the toe grips, like say on the rear. Maybe their front end's still really good, but the rear can't get up and it's the one that slips. You might be able to just put them on the rear, but they come in a packet so you can put them on all four. And we used to be able to put the dogs in the underwater treadmill with those on if they haven't been on for too long. But sometimes you'll find them where they slip off. You find it on the floor in the yard. You pick them up, clean the nail with some alcohol, trim the toenail, and then you can put the toe grip back on. So all those are going to help them with their mobility. Alrighty, how can we differentiate between age-related cognitive decline and early signs of serious neurological disease in senior dogs? Okay. One of it would be the onset. How quickly did the condition change? So the age-related cognitive decline is usually later and tends to be a little more gradual, versus a serious neurological disease would be just from that, would be something that came on more rapidly or was barely there and then all of a sudden escalates. So those are two options for looking at them. So neurological disease such as a brain tumor, there's not a lot of space in the brain for something else to grow. So earlier on when it's coming on, you may not notice anything and they're not complaining that they got a headache, that type of thing, although they can do head pressing. But as it starts, you don't notice anything. And then once the brain tumor starts, usually by the time you realize there's something and you get it diagnosed, if it is a brain tumor and it is cancerous, they will start growing pretty rapidly. And so the condition declines faster versus the age-related cognitive. A lot of those, they can go for quite a while. And those get worse too with the loss of hearing and the loss of vision with that cognitive. So if you're seeing that happening simultaneous, then that would also be an older age, like a geriatric, versus a senior dog that could be 7, 8, or 9 in a large sized dog that has those neurologic disease symptoms and signs come on. It wouldn't necessarily be cognitive because they're not that old, but it could cause neurologic. So you might even see tremors. There could be leg tremors. There could be circling in one direction. There could be changes in the size of the pupils. There's a lot of other things that will show up with the variety of different neurologic diseases that are seen. And some of those neurologic conditions could be gene related. They do a lot of different types of gene testing, and there's a lot of breeds that do have some neurologic setup. If you get just the right 2 recessive genes, then they might be one. So a neurologic condition can also show up in the rear end where there's degenerative neuropathies, and those would also fall into a neurological disease. So not just of the mind. So the other thing is also on this, if you start doing that fur tissue mineral analysis testing early, there are toxic metals that can add to all of this. And so if those are cleared out earlier in their life, then you also have the potential to spare them from either of these conditions. When should pain medication or joint supplements be introduced? Well, that's one of those that's going to be different for each individual. Joint supplements, normally we're looking at glucosamine chondroitin. As a younger body, those are going to be provided by the cells. And so I usually look at joint supplementation from that perspective, glucosamine chondroitin, hyaluronic acid, somewhere after 7 years of age, unless they're one that has had an open joint surgery. So if there was a serious injury to a joint, a fracture in a joint, really bad hip dysplasia where the femoral head has been removed or some other replacement done there, or where they've had cruciate tears earlier in life, then you may start those sooner. But otherwise, the body should be providing those. Then pain, that varies with every individual. So you have to be aware of what is that dog's, what has been their normal performance, their normal play, their normal activity, and how bad is their pain. There are many herbs that can be used for pain, like boswellia is a really good analgesic. Also, we use MSM, which is not an herb, but it also helps reduce inflammation. And anytime you bring inflammation down, then that's going to go away too. This says pain medication. So if you're looking at medications, you're thinking NSAIDs. So the nonsteroidal anti-inflammatory drugs, that would be Rimadyl, Carprofen, could be Deramax, Previcox. Those would be NSAIDs. You know, aspirin is an NSAID. So that would be one of example of what people take. And then Galliprant is an anti-inflammatory, but it's not classed as NSAIDs. So that would be another option there. Then you get into the opioid type, which are those others as anti-inflammatories. They work at reducing the pain and the inflammation at the site. When you're using gabapentin, which is actually the synthetic derivative of the natural ingredient, which is found in poppies. So if you take that or tramadol, those work at the brain level to reduce the pain perception, but it's not changing anything at the site peripherally, if it's in a joint or spine or wherever, of what's happening with the pain. So those are functioning differently. And both of those have the likelihood of, while they can reduce the pain a lot, but they also can make that individual ataxic, which is like they're drunk. And so when you have this older individual that's already has muscle weakness and difficulty getting up and navigating, to give them something that makes them more ataxic, I don't feel is like the best of the options. Not to say that some don't get to that point, and also not to say that they're in some individuals at the right dosage, you don't see the ataxia. So it doesn't affect them quite the same. And then the other pain medication, which is used selectively, would be the corticosteroids. So like the prednisone or prednisolone, which are the steroids. But one of my sayings is nobody should ever die without the benefit of steroids. So the time can come when that is the thing. But all of those have to be evaluated individually and not just put in as a general. Are there simple budget-friendly food toppers or supplements that help with joint pain or appetite loss? Well, those are two very different approaches. I think for the older individuals that the more you stick to real food, the more appetite you're going to see in those. So whether or not and so we're talking the proteins, and there are a lot of different ways you can introduce those. So just from the appetite loss perspective, those older individuals, the lightly cooked foods are going to be generally more supportive because they're not having to put their own energy into heating that food up. So you want foods that are a little bit warmer, which makes it not only aromatically more appealing to them than something cold, but also it's easier for them to digest because of not having to burn more of their fuel to get it started. So there's that. And then also using real food. So whether or not you use freeze dried, a lot of them like them in the little dry pieces, or you may soak it up. Adding in broths can help with that too. So all of those things are going to be, and then just getting real meat at the store. So what you would normally purchase, a lot of those, the chicken or the beef or turkey or whatever it is, the fish, the eggs, cheese, even, as long as they're not sensitive to any of those, then those are all going to help. And of course, my go-to for hiding foods, hiding meds in something, is to use the Braunschweiger, that German liver pate sausage. So that's always my go-to, is for something to use to hide their pills in. And then food toppers that are joint pain, then you would start looking at things like maybe a topper that did have the turmeric in it. And Dr. English has a lot of different options on his site of things that you can use. Budget friendly, again, the more you do at home, the more you're cooking from home, the better chance you have of making it budget friendly, as opposed to potentially what you're purchasing out. So, and all of that is everybody's budget's a little bit different. And I do like essential oils for a lot of the joint pain, things that you can diffuse that you don't even have to give to them. So that's not necessarily food toppers, but it is a way of supplementing and helping the joints. So the copaiba, frankincense, there's a lot of different ones there that you can look at using too. Sure thing. Yeah. You're welcome, Lenny. How frequently should blood work or dental checks be done for an otherwise healthy 10-year-old plus dog? Well, minimally, you would do the blood tests once a year. I think at that age, doing dental checks twice a year is optimal, because the mouth is such a source of bacteria that gets, so the bacteria in the mouth, having some of them really enjoy the valves of the heart. And this is where in the older animals, a lot of them develop heart disease because of the infection in the mouth. And it may be minimal, maybe it's not terrible as far as a totally infected root, but there can be enough bacteria there that they then start setting up camp on the valves of the heart, which then cause those valves to start to curl up. And so that leads to the weakness of the valves, and then you start hearing the heart murmur, and the heart has to start working harder. So twice a year, I would say, for the dental checks. And even if you're going to a chiropractor or an acupuncturist, they can always check the teeth for you too. So you can have your doctor, whether you call them the traditional or your regular vet, or whatever you speak to them, the one that does those things, the x-rays, the IVs, the blood scans, the ultrasounds, all of that for you. I would expect that you at least want those done once a year, unless your dog has some kind of a specific condition that requires more frequent testing. And there's a lot of different tests all the time coming out, and there's many that you can do through different saliva things that you get online, you can send off, and fur samples, and there's a lot of bioresonance testing that can look at the body and the organ systems from different perspectives, because the blood is that moment of that day. And it can change dramatically depending on what the adrenal glands are doing, what they've eaten. Any kind of a stress level can change blood values. So you will find end-stage destruction, like with the kidneys and the liver, which are going to be the two main ones that you're looking at. Adrenal gland function for Cushing's or Addison's, things like that. So some of them you need blood work more often, but just the general geriatric would be once a year. Can mineral tissue analysis detect heavy metal exposure that might worsen arthritis, kidney disease, or cognitive decline? Yes, that is part of what we look for. So not only is the mineral tissue analysis looking at specific minerals, calcium, magnesium, sodium, potassium, manganese, iron, copper, zinc, chromium, phosphorus, selenium. It's looking at those, but it does read out heavy metals. And the main ones that we're concerned about, because all of that is interconnected, everything, all the minerals of the body, including heavy metals, which are minerals as well. Everything is connected. So when one changes, everything changes as well. So there's key ones: arsenic, aluminum, lead, mercury, cadmium. Those are going to be our key 5 that we want to really keep a spot on. Mercury and aluminum are the 2 most common. Lead is the most difficult to find because it backs up. It's going to be stored in the bone, and it's harder to have that pulled out. So all of those can affect. The aluminum is a key when we're looking at allergies, problems like that. Mercury itself is really bad for emotional, so mental states. So the stress, but cognitive decline as well. it's also in the kidneys. Aluminum can go to the kidneys. Even just keeping track of copper. Copper, electricity moves through copper wiring. And when the copper's really high, then that can also cause an individual's nervous system to get ramped up and then with time wear out. And then just the whole aspect of other ways to look at the endocrine system. So the thyroid, adrenals, pituitary, and understanding how those then are a part of that mental decline as well, and supporting all of those. So yeah, like all of those. There's liver factors can be indicated on that test. Kidney indicators are there. And then supporting, depending on what's going on, it can match up and cause arthritis and add to the cognitive decline. Are there any risks or limitations pet parents should know before using this test? No. There's no risk because you're just going to take a first sample. Limitations? Sorry, I didn't even bring any water with me tonight. The limitation would be animals that are bald, because you do have to have about a teaspoon volume of fur. And so if it's a extremely bald individual, then you're not going to be able to get enough fur to do the test. Okay, I've got to run really quick, need a drink of water. Okay, hopefully that whets that tickle spot that was going on. Okay, weighing quality of life versus aggressive treatment. When to pursue surgery or therapies for a senior dog. Yeah. I have seen this on more than one occasion and had clients where they were almost guilt-tripped into doing more and more testing when it wasn't going to improve the life of that animal. So I always look at it like, if I asked them, would they want a therapy or would you want to know exactly what's causing it? So in some situations, the pet parents, in trying to do their best, keep looking for a specific answer. What exactly is it? And you can do tests and tests, and that poor dog is perpetually being taken back to a hospital where they're exposed to other illnesses in a sometimes frightful situation, being stuck more with the needles, having tests done, and they don't understand why it is, obviously. A person can make that choice and say, yeah, I want to go on, I want to do this. But the animals, they don't understand why it's going on. So there are many, many options of things that are out there that are available that can be done, but is it in that individual's best interest? Is that really what they would want? There's lots of different therapies that can be done. The laser, the acupuncture, the chiropractic, the PEMF. There are many things like that that can help and support. That is not injurious, and microcurrent, therapeutic ultrasound. There's a lot of things there, and a lot of things that are done and introduced through the complementary world. So adding in homeopathy and aromatherapy and essential oils that can help them. But there does get to be a time when that doing more is not better. So a recent story was of a large dog. He was a Great Dane, and I won't even tell his name. It was a really cute name, but I don't want to put anything out here that maybe I shouldn't in regards to identification. But at any rate, he had cancer in one of his legs, and he was already three-legged from something else that had happened. And they were trying to get this handled, but bone cancer is not a good option. and they did some different ozone therapies. It was healing in, and then it kind of took a little plateau, and they were at the university, and they somehow got talked into taking off that dog's other leg. So now you've got a large dog that only has 2 legs. How is that? How is that helpful? I could not see that there was anything beneficial that was ever going to come out of that. And the dog didn't even make it 2 days after that. So, yes, there's times where just because surgeons can do something doesn't mean it's the right thing to do. But that's what the job is of the parent, is to decide, for their best interest, am I doing the best thing for them? And that falls under the category of the humans making the choices. And that's what it comes to, because it's their wallet too. And they make those choices. So obviously you can see I'm not necessarily in favor of aggressive treatments at a certain stage. Any recommendations for cognitive support in senior dogs? Well, there's a whole lot to do there. There are certainly compounds out there for helping. So first off, cognitive support is making sure that the environment at home. So that is support as well. So not moving your furniture so they don't know where they're going. Having lights on so they're not confused about that. Sometimes cognitive support comes about by another dog that they can follow. So they have somebody else that they can follow around, and that helps. But supportive wise, nutritionally, vitamin E is really good for the brain. We want antioxidants to help. That's also very key. There are nerve B vitamins, certain B vitamins are going to help with the cognition. Even doing exercises, there can be different like routine exercises that can be done that can help support them with the cognition too. And there are a lot of different nerve products out there that can help support that, as well as, again, essential oils that support that you can turn on a diffuser and let that diffuse, and then they breathe it in, which goes across the blood-brain barrier and helps from that perspective too. Okay, so what simple signs at home show a dog might be experiencing tooth pain or gum disease? So one thing would be early on might be that one could be bad breath. Maybe the dog's not really even that far into it, but you have the halitosis. Another would be that you notice that they start chewing on one side of their mouth. So whether they're just eating and you can see they're chewing more, or they have a toy or something that they chew on, like their bones and that they're chewing more on one side than the other. Another might be that you go to touch them and they don't want you to touch a certain side of their face. They're afraid you're going to hit that area. Or that they're playing with another dog and then you hear them kind of yipe and cry because the other one bumped them. Might be something like that. Also, the water bowl, sometimes you might just notice a pinkish tinge in the water dish, which could be gum disease, and there's some bleeding, and then when they drink the water, it comes out in the saliva, so you see it there. That would be another thing that would give you an indication that you need to look in the mouth. But it's just with these older dogs, if you're not, you should already be doing some oral care, whether it's a toothbrush or a Q-tip with the cleaning on it or something that you're spraying. There should already be something that you're doing with the mouth. And of course, you got to make sure and get way in the back. It's easier to get the front ones. You got to pull their gum up and get back there in the back, because those are often the ones that are hiding, that are actually in the worst condition. So you want to get back in there, figure out ways that work best for you and your dog. The smaller the mouth, obviously, the more difficult it's going to be to get a toothbrush. So I like the Q-tip, and then you coat that. You might use hydrogen peroxide. I've got my toothpaste recipe that's there that you can use that and get in there and do that. There are essential oils that can be added to it. There's a lot of different. The New Zealand Deer Velvet has the oral spray. from the deer velvet and the manuka. So that works really well too. There's a lot of different ways that you can help and keep on top of the tooth and the gum disease. All right. So Candace asks, what holistic measures do you suggest for chronic ear infections where everything has been tried and one, I don't know what Tacabo and one Tacabo. So first off, chronic ear infection means that the body is too alkaline. The body has to be between, like, say, a 6.5 to a 7.2. If the body is more alkaline than that, the microbes, the bacteria, the yeast can live. So one thing is, if you haven't done, you need to look at acidifying that body if this has been going on. The second thing is low-level light therapy applied to those ears. So you can buy like laser patches and just lift up the pinna and put it there and let them, 20 minutes twice a day. Within 2 weeks, that makes a huge difference. So if you haven't done that, that is something I would do. A lot of times with chronic ear infections, if it's a dog that has the ears that hang down, the other thing is shaving up inside of those ears. So shave the inside of the pinnas, not just right around where the ear canal is, but the entire pinna, shave it really close and then down around the bottom, because you want to get air into that ear in order for it to dry. So that is also very, very important. Just keep those clipped short so that as they run, then air can get in there. So that would be another thing. If you haven't done that, I'm sure from this, you've done lots and lots of different kinds of medications and different kinds of ear cleansers. And most of those ear cleansers, their goal is going to be to help dry the ear and acidify it. So we're talking about other things here that maybe you haven't done that would be. And you can certainly answer, Candace, if you've done any of those or if there's some of those that you haven't done. And then I'll think about something else too that would be beneficial. But that's definitely the go-to. And then cleaning the ears, a lot of times I just use the swimmer's ear solution, which is isopropyl alcohol and the white vinegar. I used to put glycerin in there, but it's not available now. But if you do those two things and really irrigate the ear well, which works as long as it's not raw and sore. You don't want to put alcohol in any place that's raw or sore. But just that alone will dry the ear and acidify it. It's really good for swimmer's ear. So, and speaking of that, if the dog is in the ocean or the ponds and that gets wet a lot, would be to put that in before and after they go swimming. And then the other thing I can tell you from me having ear infections as a kid, when I used hair dryers or was on a boat and was getting air in there, this is what led me to know that if I used a hair dryer on my ears afterwards and dried them out, I wouldn't get the infections. So the vinegar and alcohol and a blow dryer worked for me. Now, some dogs aren't going to like it, but those are options. And then you find out which ones of these work for my dog. All right, Jennifer, just looked up total ear canal ablation. Yeah, we did some of those earlier on. I did that on a rabbit one time that had their abscesses are really super bad. That's a last resort. If you haven't done laser, I would definitely say do the laser. I had one come in, a beagle dog, and both ears were just the hugest cauliflowers you ever saw. I mean, there was no space to even get a drop of something. It seemed through there. They'd been going on for so long, the poor little dog. And within 2 weeks of doing the laser, it was halfway down. And by the time we got to 6 weeks, you couldn't even tell that dog ever had a problem. And that would have been the kind that they would have done the total ablation and the osteotomy. Okay, good. So Candace, I helped you on some different things. Thank you. You're welcome. Okay, Jennifer said she has good luck with MCT oil and grapefruits. Oh yeah, I could see how that would work. Yeah. And yeah, that, at any rate, those are good for the reasons. I like grapefruit as the fruit itself, but also the essential oil grapefruit take with you and put in your water when you're at restaurants, and helps with digestion. And yeah, that's really good. Okay, Laurie says, my 12-year-old husky mix has arthritis and still very active. Okay, that's good. She has slowed down a bit and seems stiff sometimes. Okay, vet suggested pain meds. Any holistic suggestions? I do supplement with some herbs. Okay, so my first thing is slowed down some is a bit stiff would be chiropractic, number one. Number two would be massage. And number three would be some little exercises that I would give you to do that you would do with her that would help to reduce that stiffness. Some little range of motion, some massaging, some balancing exercises. I would do all that. And then, add in, sorry. You're doing supplements with some herbs, so I'm sure you're already on boswellia and some of the good anti-inflammatories, maybe MSM, probably the glucosamine, chondroitin, hyaluronic acid. If you're not giving hyaluronan, that's also very good. Trixin is a product by Cogent Solutions, at least it used to be Cogent Solutions. Trixin is really good at the hyaluronan, so you can find blends of that. And then I was just talking with a doctor today. If you have a really large dog, and you're wanting to do that kind of a product, you're wanting to help their joints. A lot of times with a large dog, so we're talking the ones that are over 100 pounds, I send them to the horse product line. I mean, the glucosamine's the same, the chondroitin, MSM, yucca, boswellia. I mean, it'll have a slew of that in there, of those products in a liquid form, and you can dose that down for your large dog. So it's much less expensive, and there's very high quality in those. They'll have hyaluronan. It'll have a big, broad spectrum. And so, any rate, a lot of times with the large breeds, I just pick out or send them to the feed store and get a really good equine liquid, and then we dose it down for the dogs. So when you're talking about saving money, that's one way to do it. Warm compresses in the morning to help get the old ones going on the joints. Cool compresses at night if there's certain areas, like a certain leg that seems to be more stiff, a hip or a knee or something. So warm compress in the morning, cool compress at night. That's another holistic suggestion that can be really good for those joints. A lot you can do before you just go to the pain meds, that for sure. And don't get talked into doing that injectable that's just come out. It's a really bad thing. So at all costs, avoid that. Librela. It was set to go on the human market, but it never was cleared. And so they then ramped it into the animal world so that the company could make their money on that. It didn't want to be out. Okay, so the question on the oil and the grapefruit extract. I think that's one you feasibly could even mix as drops and put it in the ear, but otherwise, yes, you can put it in food. Yeah. 1 ounce. Okay, thanks for the recipe. Go back to that recipe, Gendy, so they can see that. Yeah, it's only 3 drops of the grapefruit seed extract. 1 ounce is the same as 2 tablespoons, if somebody didn't know for sure. That's 30 mLs. 1 ounce is 30 mLs, and that's 2 tablespoons. Okay, thanks, Jennifer. All right, Gendy, you've been doing a great job pulling those questions and getting them up there for us. Let's see. So I've talked about some of these that we had in our program today, and we've addressed them in some of your questions. Okay, I can talk a little bit about the gut health in the older individuals too. Everybody nowadays is inundated with the whole microbiome thing and trying to help the gut be as healthy as possible because of the gut impact on the brain as well. So there's connections to everything from the gut. It's very key with the immune system. You know, even the dogs that have those weepy eyes, that running of the eyes, the epiphora, where they get the browning there, it turns brown because the tears are alkaline, and that will make that brick red color, just like if they lick on their carpus and then it gets that space where it has that brick red color. That's from the alkalinity of the saliva. And certainly the more alkaline their body is, then the more that's going to, the more brick redness you will see where they lick. The more acidic, the less of that. But the gut itself. So another aha that I've had in regards to doing the fur tissue mineral analysis as long as I have is that the gut microbiome, what is living in that dog's system. So we know what would be optimal, what's the best type to have. But what's living in that dog's system exists because that's the environment that is provided for, and it will only house that particular population. And I call this the friends and family plan. You want to have a large volume, a variety of microbiome, a lot of friends and family, so that when something else, and goes back to feeding variety of foods, not getting stuck on any one kind of food, because the more they've eaten only one set of ingredients or one type of food, the smaller and smaller and smaller their microbiome variety becomes. And then once they get exposed to something different, all of a sudden it's cowabunga. Nobody's here to handle this. You can't even dial somebody up for help. And then, as they would say, all shit breaks loose. So you want to introduce earlier on a variety of foods so that this creates a larger friends and family plan. The other thing we need then are all of the necessary nutrients for those populations to exist. Otherwise, you're only going to have on your report, when you turn this in, when you turn in your samples and you get your report, what's listed there is what is supported by the nutrients that is being provided to them. So now we're back to talking about that fur tissue mineral analysis test. In that hair, when it was forming, that follicle was being fed. It was all the fluid around it is all of the nutrients that is carried not only to it, but every cell of the body. So that's a reflection also of what's available to the microbiome, because the food is coming in and then those nutrients are being picked up and then circulating around. So everything, there's hormones in that interstitial fluid. There are the fatty acids and even compounds and drugs go through that interstitial fluid. And that's how you can test, why'd somebody die? Were they poisoned? So you test for something. Was there an overdose? You can test for it in the hair. And so we want to have this larger friends and family plan in the gut. And that is also going to be another area that can reduce those early cognitive states. So start early in feeding a variety, keep that up throughout their life. If you do the microbiome testing, realize that you really need to have the minerals aligned first. Otherwise, that population, you're going to spend the money. You're going to get the good guys. You're going to put them into that body, and they're not going to live very long because what they need to live on is not even available. So then they die off fast. And then you're back there to another test, and it's not that much different. Oh, so is there a test for DM, degenerative myelopathy, or just diagnosis of exclusion? No, there's DM tests available now. And you can even do genetic testing if you know, like if your dog's a purebred, those parents can even be tested for the gene for that. And so you could do, I guess even if you had a Heinz 57, there may be one breed that's stronger, but you would have to have several recessive genes in there for the DM to show up. Most of those are recessive traits that then you'd have to have two parents with recessive genes in order for it to show. But there's a lot of different testing that can be done for DM specifically, and it can be done earlier in life. And then whether or not you don't have to worry about it, or you get to keep worrying about it because they have the gene. So you can have it where it doesn't show up at all on the test, or you could have it where it's, they have it, but they're not going to likely get it, or you could have the test result where it says it's probably going to happen, or it is that. And then there are a lot of different, I was recently looking up neurological degeneration for different breeds. And there are, I don't know, 16 different or more conditions and many, many, many breeds that they can now genetically test for a variety of different conditions. But in the end, they all look similar to DM, but a lot of different names, a lot of different, they're all gene though related. So in the end, you can't walk, you can't walk. There could be a lot of different reasons that you can't walk, but still it's weak and they're dragging their feet and slow in the rear and can't push themselves up, and feet don't flip over, all of those. But it could be DM or it could be something different. But again, your point is that in the end, they can't walk. And so basically they're treated the same because it's genetic. So you're treating for the symptomatology. Okay, Lori's back. My girl, so she's talking about her dog girl. You look at that picture. They're so cute. My girl likes to chomp on goldenrod. Oh, well, that's not bad. Does anyone really know why dog chews on grass? Yes, I definitely know. So this is my take on this one. Grass has chlorophyll in it, just like a lot of different greens. Anything that's green has chlorophyll. And chlorophyll is very soothing to the epithelial cells. So the cells that line the esophagus, the stomach, the intestinal tract. It's very soothing and healing. It's also very good in kidneys. If you get end-stage kidneys or any kind of degenerative kidney conditions and you're trying to help with that tissue and help to clean toxins out, chlorophyll is very good for that. So when the dogs have an irritation, they will seek out the chlorophyll. And so that's in the grass. Chlorophyll also breaks down guanidine, and guanidine is a chemical that the body produces at the site of inflammation. We're talking like a high degree, like a burn or high level of inflammation, like a dog whose joints, we call it crepitus, where you can feel that bone grating on bone, that kind of thing. There's going to be guanidine laid down there by the body because of what's going on. And it's the same as like if you take a bite of that pizza that just came out and you said, I really should wait because the cheese is probably hot, but you didn't wait long enough, and you bite into it and you burn the roof of your mouth, or that cup of hot chocolate that you drank too soon, burn the roof of your mouth. Well, it burns. You've got the blister there because of the burn. And then it continues to hurt for a few days. That's because of the guanidine. So chlorophyll Okay, I'm back. Um, Are we back going? Gindi? Okay, good. So I was talking about the chlorophyll. We were talking about the guanidine. So chlorophyll then within an hour and a half will break down that guanidine and take that pain and inflammation away. So that's why they chew on grass. Now, and such, if the and such includes anything green, then anything green has chlorophyll. So it would be the same. And actually, there are different plants. A lot of those plants are medicinal. So goldenrod is medicinal. There are a lot of different medicinals. And at different times of year, what's going on with the dogs, they've got a lot of different owners where they'll go to a certain area and eat on a specific bush or find a certain plant that they know is helpful to them. So that's not unlikely that a dog knows which plant is going to make them feel better. It's just that sometimes if the blade of grass is wide and it's real rough on the other side and they take it on an empty stomach, they're chewing it, then that rough surface can aggravate the stomach wall. And then that irritation then makes them upchuck. And so then they vomit up all the grass or they ate too much of it, that kind of thing too. And maybe they do have an upset tummy, but what they're wanting is that chlorophyll to help soothe everything. So that's the scoop on chlorophyll and grass. All righty. So we got one more question coming up. You guys have been great tonight. Oh, would lion's mane help? Oh, it's potential. It possibly could. It really just depends on which type of degenerative myelopathy is going on, but not to say that it couldn't make a difference. So that would be an option to add in. All right. So I guess that's our final question. I appreciate everybody being with us tonight and for joining in. Can we ask questions later? Oh, sure. Yeah, Candace, you can always send an email. Sometimes I can answer something pretty quick and it's not like a big deal. But if you've got a lot going on and you want to know specifically or actually have more of a conversation or share lab tests and things like that, then doing a regular consult would be better. Yeah, because we can get more accomplished there. But I can do that anytime. Yeah, you can just send me an email. And you guys know how to get a hold of me anyway. Alrighty, so we've got some more good things coming up tomorrow, and then I'll be back with you tomorrow evening. So we've got an awesome show. We're going to talk more about the seniors and what we can do to help make their lives easier and help them live longer. I've got a lot of those old ones nowadays, since I've been practicing this way for 20 years, where they get up to be, like Irish setters, English setters, German shepherds, are in their 15s and 16s and doing really great until, like a 2-week span, all of a sudden they start declining and then it happens fast. But up until then, they've been great. So don't just think because you've got a larger breed that you're going to have to say goodbye early. There's a lot you can do and a lot of things that we're sharing with you at this Pet Summit. So I look forward to being here with you tomorrow night, and I'll make sure I got some water and some lozenges. All righty. Happy trails.